Hello and welcome to the final therapy edition of Inside OSA, your source for useful information about living with obstructive sleep apnea. I'm Sherry Smith and I'm here with John Matthews. This program provides valuable insights on how to regularly use your therapy in order to enjoy more positive long-term results. A sleep expert looks at how people who understand and accept their disorder are better able to tolerate and benefit from therapy. A group of patients recall the issues they faced in the first weeks of PAP use and the subsequent impact therapy had on their lives. And John Matthews explores potential obstacles to therapy and offers strategies to overcome them. John, what are some of the possible roadblocks that people who are new to PAP therapy might encounter?
The three most common roadblocks to regular therapy usage are discomfort, issues related to the bed partner, and travel. Many individuals experience a runny nose with the initiation of PAP therapy, especially if they're not already using humidification. This also typically resolves with time and use as the nose adjusts to the additional airflow. Other individuals experience nasal dryness. Options to address dryness include being sure that you are adequately hydrated and using topical normal saline nasal spray before initiating PAP therapy. Cool passover humidification or heated humidification are used to provide long-term relief. Individuals who experience sinus discomfort should consult with their sleep specialist who can prescribe decongestants, topical anti-inflammatory medications, or heated humidification to help alleviate these problems. Mask selection plays a critical role in overall comfort. People should look for mask styles that suit the way they sleep. Remember that a well-fit mask will be more comfortable. Over-tightening the mask can cause pressure sores and actually create more leaks. Masks are designed to seal against the face with minimal pressure. Not all air leaks need to be fixed. Small intermittent leaks around the mask that are not bothersome can be left alone. Of course, leaks into the eyes and ones that interrupt sleep should be corrected. PAP systems are designed to compensate for leaks. You will still receive your prescribed therapy. Some people experience sore chest muscles because the positive airway pressure expands the chest at night and stretches the chest muscles. Fortunately, that soreness tends to resolve with time and with regular use of the PAP device. New technologies like flex therapy have significantly decreased the number of individuals who complain of difficulty exhaling with positive airway pressure. When C-Flex technology does not address the complaint that is limiting an individual's ability to regularly use therapy, a sleep specialist may order a trial of bilevel therapy. Many new PAP users are apprehensive about their significant other's response to therapy. Clinical research shows that untreated OSA disrupts a bed partner's sleep, causing them to lose an average of 1 hour of sleep per night. Fortunately, the bed partner's sleep time and quality improve with the introduction of therapy. A good way to help significant others develop an appreciation for PAP is to share this and other health-related information about OSA. People with sleep apnea should take their therapeutic equipment with them on every overnight trip. Most people find traveling with PAP fairly simple. Airlines recommend carrying the device onto the plane. And since security agents are trained on PAP devices, there should be no problem. Many PAP models have universal power supplies. Those that do not require a universal power adapter for use abroad. Higher elevations can make untreated apneas and the accompanying drop in oxygen levels more severe. It also affects the pressure output of the PAP devices. Some PAP units automatically adjust for altitude, and some have to be manually changed. Adjusting the equipment for changes in altitude will ensure accurate delivery of the prescribed PAP pressure. By learning to address these common roadblocks to regular therapy, people with OSA are able to get the restorative sleep they need.
Thank you, John. To get some insight into how people integrate therapy into their lifestyles, I spoke with a group of PAP users about their ongoing experience. I'd like to thank all of you for coming today and sharing your experiences about OSA and CPAP therapy. We'd like to welcome Lanita and Dave Myers, Raul Guevara, Dr. Matthew Abraham, Peggy Jennings, and Dee Stanley. Do any of you travel with your PAP device?
I had to travel abroad worldwide, did about 4,000 miles inside China, brought the machine with the power adapter with me to China. It's easy. It becomes part of your luggage.
I travel a lot also, and some people that may not travel all the time get worried, like, can I take this anywhere? If you can take it anywhere internationally. And if I'm carrying this machine through security, is that going to be a problem? They all know what a CPAP machine is.
Is that right?
Everybody knows. It's like, oh, hey, I have one of those at home, or oh, I have a friend, or my father, or my mother. So again, it's this big community. There's this big support community out there, and then all the devices do have a little labeling on them to make sure they know it's a medical device.
What do you do when you have an issue with your therapy?
If it's like a matter of how the mask fits, you can readjust it, or maybe if you're having some concerns about the air pressure, you might talk to the doctor and have the doctor take a look at it again, seeing if the pressure needs to be raised or lowered or whatever the case may be.
So I think if it's an equipment issue that you think, your nose is dry, I mean, you always let your doc know, but your home care provider is a great resource. If you're wearing this thing every night, doing what you're told, and you don't feel better, something's wrong. Go back to the doc. Do you need to change your pressure? Do I need to put you on a different type of therapy? So don't give up. If you're wearing this thing and you don't feel better, don't give up on the therapy without going to your doc and finding out.
People overlook the importance of sleep. We all think we need sleep, but we don't really accept it as being that important. For example, when people get tired at work, oh, there's something wrong. You're just, you're lazy, or you don't want to do your work, or that people make accusations, but we forget that sleep itself is vital to feel good. And we just don't accept that as being something we should treat in the society, and it's hard to convince people about that.
What impact has PAP therapy had on your life?
It helps you get control of your health. Just makes you feel better about yourself. We've all demonstrated what it's done for our families. Who doesn't want to be a happy family person? Who doesn't want to be a good employee? For me, I looked forward to going to work in the morning. I looked forward to getting home, not so I could get more sleep, but so I felt like I'd missed out on some times with the kids where I didn't have to be so grumpy or cranky, perhaps.
You didn't sleep in the same room half the time.
Yeah.
That's right. I would get up in the middle of the night when I couldn't sleep any longer and go to the couch, or I'd kick him out of bed because I couldn't stand it anymore. And so you think about those kind of things versus actually being able to be in the same bedroom with your spouse. That's a significant life change.
I'm going to be on medication all my life for hypertension. But since I started using the CPAP machine, my blood pressure has went down. I'm still on medication, but I'm on a lower dose. And I think with the CPAP machine and with my sleep study, I think miracles are going to happen. And it's just like, if you need it, you need it, and go ahead and do what you have to do and get on with your life.
Thank you very much for coming and sharing your experiences with us today.